A defined or chiseled jawline is the sign of youth, but as we age and accumulate sun damage, the turkey neck and jowls appear. Figured I got that part.
The turkey neck. So can a quick lunchtime painless procedure be the answer for you? Medical reporter Meg Ferris takes a look at the procedure that has no downtime on tonight's Wrinkle-Free Friday.
At 56, Pat Driscoll noticed something she did not like, the skin hanging around her neck and jawline.
I caught a glimpse of myself in pictures, and I thought that, gosh, do I really look that old? Yikes. So it just kind of bothered me that there was so much like excess skin and just droopiness.
But she does not want to have surgery or a laser treatment that's going to require a lot of healing and downtime.
I'm not trying to look like a 20-year-old. I just want to look the best, be the best I can be, I guess you could say, for my age range, and I'm very happy with that.
It was 5 years ago when Wrinkle-Free Friday took a first look at new technology called the Titan, an intense pulse light set to reach the deepest layers of your skin. It heats it up, causing your natural collagen to shrink and tighten, while stimulating new collagen to grow over the next few months. That fills in wrinkles over time. Doctors were using it on the brow, face, neck, knees, elbows, buttocks, and abdomen after pregnancy, and areas after liposuction. There's no surface peeling, redness, or pain, or scabbing, so you can do it on your lunch break and go right back to work. Now, lately, doctors have been using the Titan on people who just want to tighten up the jawline.
But for a patient between, say, 35 and maybe 55, depending on the patient and the integrity of their skin and their bone structure, I think they can get very nice results with these technologies.
But dermatologist Dr. Mary Lupo says this is not a replacement for surgery, and you should expect results to be less dramatic.
I think that Titan is something that is really more of a preventative than a corrective. And I think when you use it on patients who are, say, 40 and just beginning to notice that little bit of jobble here and their little bit of sagging here, that you can see some very nice results.
The most recent studies with Titan showed about a 10 to 12% improvement in lifting in the jaw area. So I always tell patients, if you're willing to accept sort of subtle results and you may not be a surgical candidate or want to have a surgical procedure, these things do have a place, I think, in the treatment of our patients who are desiring improvement of contour.
There are older patients in their 60s and 70s who have used the Titan. Some do well, but others don't. The results are inconsistent at that age and on heavier patients.
If a patient has very heavy jowls, this type of technology is not going to be enough to give a lift. But in thinner patients, in patients who have a little bit of hanging and a little bit of sagging, I think you can get very nice results with no downtime and substantially less expensive than surgery.
Will other people notice a 10 to 12% difference in a patient?
You know, if you look at the before and after studies on Titan, and they have a couple of before and after photographs, I mean, they're very subtle improvements. So I don't think people are going to come up to you and go, wow, what have you done? But I think that there will be subtly appreciable results.
And that's what patients say they noticed. People think they've lost weight or they need less contour makeup since their jawline is more chiseled. That is what Dr. Lupo's patient, Pat, is noticing too.
The results are not extremely dramatic, but it is noticeable. It's more subtle, the kind of thing where people think that you look better, but they're not certain why. You just look kind of glowing and refreshed.
For Wrinkle-Free Friday, I'm Meg Ferris.